Thank you for having me here first. It's wonderful to be here. So, yeah, I'm Dr Sue Kenneally, and my job is as a weight loss physician here in the UK.
Amazing. Well, thank you so much for joining me for 45 Strong. And let's start with the first question, which is what does being strong mean to you?
Now, I got wind of these questions before we sat down to have a chat, and that was one that really made me think. And I think I've got to it. I think to be strong, we associate strength with physical strength, and I think that's true. But to be really strong, I think you need to be physically, mentally, emotionally, and spiritually strong. And I think that's a balancing act, and I think you need strength in all those areas to be truly strong. And what that means to me is having the ability to consistently live in alignment with my core values. And I think that's what strength really is at its root.
It's curious because obviously I think you're the 12th or 13th lady I've spoken with,
Okay.
and there are similar threads occurring, and it does appear that core values seems to be quite present for that.
Yeah, absolutely. And that can be quite challenging because, first of all, you need to know what your core values are. And then once you know what they are, I think it's about making decisions consistently day by day. So I don't think it's about the big mountaintop experiences or what we all know, you know from your world records, that actually by the time you get to that day, most of the hard work is done because it's all in the preparation and the day-to-day grind of getting to that stage. And I think that's mainly what this is about. So I think really it's about getting to those core values, knowing what they are, defining them, realizing what that means for your daily life, and then just living it. And that sounds ever so simple, and it's really not. I think you need wisdom, and more than anything, think you need vulnerability. You need to accept the fact that you may fail.
Yeah, that's really wise. And can you give an example in your own life of when you had to be strong and how did you handle that?
Yeah, sure. So again, I've had some time to think about this, and I think for me, the best example is when I decided to become vegan. So that was about 10 years ago, possibly more now. And if I lived just by myself in an island, then that would be fine. I could just go and eat vegan food. But actually, I don't live on an island. I live in community. I live with my husband, who's a stay-at-home dad and does all the cooking. I live with a family. And there's things like eating out, restaurants, social occasions. It can upset a lot of people, especially 10 years ago when it wasn't as easy as it is now. So to consistently say to people, no, I'm not going to eat foods that contain animal products anymore, really upset things at home. But my husband is wonderful and he went with it. He was fine. And he's still not vegan, but he will cook vegan food for me consistently. My family were very supportive. But to consistently go against the flow and be different took a lot of strength. So it was about persistence, it was about grace, it was about humility, and it was about gentleness. I don't think going into the world and being a militant vegan and saying, well, I'm vegan, so you just have to deal with it, is the way to go, really. I think it's about gentleness and love and grace and but just being in community and trying to make it so that people understand and support you.
Yeah, beautiful.
Yeah.
So the next question is, how do you think societal expectations about women affect the concept of strength?
Yeah, another challenging question. So I think men and women are probably equally strong, but probably in different ways. So the typical role of the man is to be hunter-gatherer, provider, protector, and that obviously requires strength in a very obvious way. But then I think to be the conventional role of the woman, if that's what you are, I mean, you're not and I'm not, but even the conventional role of the woman requires an awful lot of strength because it's carrying the mental load, it's worrying about the home and the children and the family and the wider things of life. And that requires just a different kind of strength. But in terms of strength in general, I think as a society we do tend to think that it's about the masculinity, it's about the muscle power, and we don't think about the resilience and the carrying the mental load of so many different things all at one time. And I also think that people expect women to be little and timid and sweet and the people who give in. So if a man says, we're going to do it this way, the woman will just go, okay, that's fine. And that's not the way we are as a society anymore. I think that's shifted. And I think mentally, I think we're all still catching up with that.
I'm curious. I mean, I'm going a little bit off script now.
Yeah.
Because you are a doctor, you do see men and women patients, I'm guessing.
Yes.
Have you noticed a difference in the conversation around weight management, about body images between man and woman, or, you know, and I appreciate there's more than just man and woman as well.
Yeah.
But yeah, have you noticed a difference there?
Yeah, a big shout out to my transgender patients, absolutely. But yes, it's very, very obvious. So men will come in and they will say, I need to lose weight because I need a hip replacement, or I need to lose weight because I have diabetes, or whatever. It's because it serves a purpose and there's a definite function. And they don't really mind about their weight, but now there's a problem that needs to be solved and the weight needs to be lost so they can solve that problem. And it's all very logical. Not all of them, that's a stereotype, but I think it's fairly reasonable to make that generalisation. And there are a lot of women who say the same thing, and particularly those who come in maybe because they need to lose weight because they want to have a baby. So for them, their weight really wasn't a problem, and then they couldn't get pregnant. And the doctor said, well, the guidelines say your weight has to be a certain level before I can give you fertility treatment. So they come in and they say, can you get me down to that weight, please? So there are lots of cases like that. But most of the women who come and see me sit there in tears and they say, I look disgusting, I hate myself, I'm an embarrassment, I don't want to leave the house because people judge me when they look at me. And it's a completely different mindset. And it's absolutely heartbreaking because it shouldn't be. We know that there are more than 100 causes of weight gain in the UK. Most of them are beyond the control of most people. So the first thing I try and tell my patients is it's not your fault. And especially for the women, you're beautiful. So yeah, it's very, very different.
Yeah, it is curious because I think that's also part of the projection of society that we're trying to fill a certain role or physically, you know, visually and standard. Yeah.
Yeah, absolutely. We're expected to look perfect, be perfect, achieve perfect, and none of us do. And we shouldn't expect that of ourselves.
Yeah, thank you for that. And yeah, the next question I've got, you know, what are some common misconceptions about strength that you might have encountered?
The big one for me is that if you've failed, then you're not strong. So if you go out into the world and put yourself out there and say, I'm going to achieve this and I'm going to do great things, then if you don't achieve that, it's because you're weak. And that, I don't think that could be further from the truth. I think a lot of the time success is a numbers game. It's about what you do when you fail, and it's about learning from your mistakes, and it's about the daily grind and eventually getting to the point where you succeed in whatever it is. But failure is an inevitable part of the journey, and it's not weakness. In fact, getting up after failure and trying again is really the strength.
Yeah, yeah, and you know, we were talking afterwards. I know you go to the gym a lot.
Yeah.
You know, I'm trying to learn how to do a push-up, and I still can't. But you know, when you go to the gym, you push to like doing 20 reps. You might only get to 15, but you know, you're getting closer to that 20, and that's not failure. So yeah.
Absolutely. You know, being able to do 15 reps of anything is pretty successful, actually.
Yeah. Thank you. And how's your understanding of strength influenced your approach to goal setting and success?
So strength with goal setting and success. Again, I think it's about redefining what success is. I think for me, success is being persistent and keeping going towards those goals, whatever it is. And so every day where I get up and I'm getting even a tiny bit closer to my goal, I think is success. And so it's not about the mountaintop experience where I've achieved whatever it is. It's about just the daily habits, the daily decisions to keep moving forward. So in terms of how that affects my view of strength, I think that's where the strength is. It's not about the amazing miracles. It's about getting up and exercising, getting up and fueling your body right, getting up and making the right decisions. And that's where it fits, really.
Yeah, and it ties in nicely to what you were saying at the beginning as well, that, you know, it's not about the days when we're on the bike doing the world record or climbing the peak of the mountain. It's the months and years leading up to that moment that we need to be celebrating and seeing as a success.
Absolutely.
Yeah. And could you share from your own experience a tip or technique that you've developed for nurturing strength?
Do you know, I get asked these kinds of things all the time, you know, your top 3 tips for weight loss or your top 3 tips for something else. So top tip for strength, I'd like to make it something generalizable, and I'd like to make it something easy and maybe something that people haven't thought of, because everything that we've just talked about fueling yourself well, about exercising regularly, about finding out what your core values are, all those things, absolutely, doing your inner work so that you're mentally ready for it, absolutely all of those things. But my top tip would be Quality downtime. Okay, so when you relax, properly relax, whatever it means to you. So for me, it means getting to the beach, getting out in nature, reading something wonderful, doing something creative, playing music, that kind of thing, rather than just flopping in front of the TV. Now, I do flop in front of the TV from time to time, of course I do. But for me, it's when I do have rare time off, it's about really doing something beautiful with it, so that when I go back to being strong and pushing forward, I'm mentally and emotionally and physically ready for it.
The words you just said, I love how you almost said it, which was beautiful, because you're full of beauty. There's a moment where we can actually fully surrender to that element of creativity or connectivity, rather than having, as you said, the TV where it's sort of passively put on us.
Yeah.
So yeah, I like your accidental words. I'm going to use it.
Good. Okay.
And just, I like circles and completions.
Yes.
For the last question, it's actually the first again, which is, what does being strong mean to you?
Okay. So being strong, well, I think I've already said it really, but being strong to me means just getting up every day and making the small daily decisions that add up to the big total. And it's not magic, and it's not anything that there's nothing special about me. It's just been forming daily habits and just having the right mindset, which I think anybody can do.
Well, thank you so much, Sue. It's been very enlightening, and I love this because I'm getting to know you on a different plane as well, because we're asking questions we don't normally do when we catch up.
Absolutely.
So, yeah, thank you so much.